We're back. I'm Tina, and this is Tina and Friends, and my friend Larry Harrison, our insurance guru, and of course, Tony Barney, our wonderful attorney who has the answers. All right, I want the answer. Are we going to have insurance police?
Well,
the Office of Insurance and Detention.
If insurance police is an arm of the Internal Revenue Service, I would say yes. We are hiring at the federal level. I believe the figure was upwards of 16 or 17,000 new IRS agents. So if they are the quote insurance police, then I guess that's a term we can determine whether or not that actually fits or.
Well, it could be like this. You get
Gestapo
pulled over.
works.
Okay, well, you get over, driving down the street, want to see your driver's license, registration to your car, proof of auto, and health insurance. There's that.
Whoa, there sure is. And maybe they'll just ask you for other papers too. Do you have the right to just drive from this side of town to the other? Maybe not. Anybody that doesn't feel just a little queasy about what's going on right now, my question to you is, what the hell are you thinking? This is a scary, scary deal, and this is only the beginning. Now they're talking about making 15 million. You know, it's like, who knows? The government can't count. They go out and say there's Mustangs out in the prairie, and they say there's 3,000 and there's 700. Now they're saying there's 15 million illegals. There's probably 60. What do we do about the illegal aliens? They're going to have to make them legal in order to get them to comply, or do they just get a pass?
Well, I think that this is the springboard for the legislation that they are going to introduce on immigration, because of the fact that we have many illegal aliens that are using the healthcare system now. The solution, and I can see this being advanced by several entities here in the United States, albeit political or other parties, that this is our solution, is that we make all of these illegal aliens, resident aliens and citizens, so that we can create more of a pool of mandates, personal mandates for the purchase of insurance at the individual level. So now wait a minute.
So then they all have, I don't know, 4 or 5 friends, family members back in Mexico or Guatemala or wherever it is that they came from. So do they get to bring their family members here too? And so do we go from maybe the 15 million number up to 60 million because of their family members that they can bring?
Well, I think that we're going to be following the same immigration laws that we are not now, except that if
we don't follow any immigration laws.
If immigration reform passes, I think many of the laws are going to be relaxed, obviously, by mandate of the federal government when the law passes, allowing less constraints upon immigration status. And as a result, we are going to have an influx. Like as you indicated, it's probably not going to just be from Mexico or Canada or any other places. It's going to be from everywhere.
Well, I mean, let's say this. Answer me this too, Larry. If people are trying to get into this country illegally, see that we're going to offer, okay, carte blanche, are we not going to have more people sneaking in before they get this law passed?
Maybe they don't have to sneak in. Maybe they'll be their domestic partner.
Oh, yeah, it could be that.
And there's another factor that you raised. As we increase the entitlements in our society, we are enticing other people from other nations to come here. I had a friend that much summed up a lot of the dynamics of politics and so forth. He said, if you throw open the doors of a nation, you can tell the benefits and the greatness of a nation by whether people come in or leave. And I think if we throw open the doors of this nation, we will watch people flow in.
Oh, sure. No one's running to China. Oh, no, no, no. Who wants to sneak into China? Raise your hand. Oh, no. Want to go to, nope, I don't think so. Or how about North Korea? There's a good one. Or Cuba? How many people are trying to escape from Cuba? I mean, it's crazy. It makes me nuts. So what's going to happen?
Well, anything that is unsustainable is.
It's just going to crash into the rocks, and that's the end of the deal. And we get to start over. Do we get to start over? Do you think we get to start over?
No, and unfortunately, I think that that's where we get into the issue of, can we afford this? And
We already know we can't. We can't afford a matchstick.
I would absolutely agree. As Larry said, we're talking about unfunded mandates. And the problem that we're dealing with right now is that as this federal health reform law goes into effect, the states are now going to have to shoulder the burden of the increased eligibility under Medicaid. And right now we are seeing really a convulsive attack that has hit many of the legislators at the state level when they realize what they are going to be responsible for in terms of paying for this increased eligibility under Medicaid.
So for those who will not work, they're going to raise your property taxes twice. Yeah, double your property taxes so you can help someone who just won't get a job. I mean, it's just the American way. We can just wrap our arms around each other and sing Kumbaya as we go down the drain. People say to me, Tina, you're a little bit extreme sometimes. Of course, that's not true. We all know that's not true. However, I feel extreme when I feel threatened that I'm losing my country. Is that wrong? Am I wrong?
No.
We're losing everything we know to be the American way, are we not?
Losing
A lot of it.
everything.
Okay, so
There might be some good, there are good parts to this bill. There really are. Unfortunately, a lot of that is going to be implemented this first year, 2010.
the candy's first.
The candy. Okay, so we get the candy.
And y'all get sick to your stomach
And these
from
are
eating
the
the candy
easy
later.
things that could have been done very simply. The National Association of Health Underwriters has always said we need healthcare reform. We just needed logical healthcare reform. We need something that makes sense, that is financially viable. And with unfunded mandates, it just doesn't help anybody. And if we could just get people working, they'll be able to buy their own insurance.
Well, I don't see, I mean, I see what you're saying, but I see this being an absolutely undermining of this country. If we can't afford it, we know we can't afford it, we're almost broke. And yet here, supposedly intelligent individuals that are in Congress and that are in the Senate and in the White House are making us go into a program that we can't afford. You figure out if this is a good idea for this country. We'll be right back.